So now we're going to go on to the peripheral nervous system. So the peripheral nervous system includes all the nerves that connect your CNS to the body parts, connects the brain and spinal cord to the body parts. It has two components, the sensory component, which detects the sensations from the outside and passes it on to the CNS, which includes the brain and spinal cord. And then the central nervous system processes the information, analyzes it, and transmits the response, that is the motor pathway, okay, to the glands and the muscles. That is the motor output. So you already know this. Now the sensory division, which is what we are going to look at today, the sensory division consists of neurons that carry the information to the central nervous system. We also call this the afferent division. Afferent because it's going towards the central nervous system. Now, in the sensory division, we have nerves that carry the sensations from your organs. Okay, so from your muscles and from the joints. This is called the somatic sensory division, okay? And then you have the visceral sensory division, which is sensations from your internal organs, okay? So which you are not aware of, like changes in blood pressure, changes in your oxygen levels in blood. So that is called the visceral sensory division, okay? So the somatic sensory division includes all the sensations from your skin, muscles, joints, etc. Whereas the visceral sensory division, viscera means organs, internal organs. So visceral sensory division carries the information from your internal organs. Now, the the motor division, you already know. The motor pathway, there are two. One is called the somatic motor division. Somatic is the nerves that are controlling your skeletal muscles, which are voluntary. Okay, so this is your voluntary division. So you are able to control this. So somatic motor division controls your skeletal muscles. And then you also have a visceral motor division, which is also known as the autonomic nervous system, okay, which basically controls all the internal organs, the functioning of the internal organs and the glands, the cardiac muscle, the smooth muscle, etc. Okay, so sensory division, what is being carried, also has two from your body, external body parts and muscles, and from your internal organs. Okay, the motor output, that is the command coming from the central nervous system to your body parts, also has two divisions. One is called the somatic motor division or the somatic motor system, which controls all your skeletal muscles, which are under your conscious control. And then you have the visceral motor division, which is going to control the activity of your glands, your muscles, cardiac muscle and smooth muscle. Okay, skeletal muscle is this. So this is also called the autonomic nervous system. Under autonomic nervous system, you have two subdivisions. Okay, the sympathetic and the parasympathetic. Okay, so this is the main divisions. I told you about a third division, which is called the enteric nervous system. But remember these two, these are the most important ones. Okay, so the autonomic nervous system, which is the motor output to your internal organs. This is divided into the sympathetic. And whenever you talk about the sympathetic nervous system, remember that sympathetic nervous system is responsible for your alertness. Okay, whenever you are performing a physical activity, whenever you're like exercise or when you're stressed, this is the system that helps you to handle that activity. Okay, so when you wake up in the morning, this is the nervous system that alerts you, and then you start your daily activity. So we refer to the sympathetic nervous system as the fight or flight system. So whenever you're faced with a stressful situation, either you can fight it, face it, overcome it, or you can just walk away from it, okay? Whatever it is, the sympathetic nervous system is the one that helps you to handle this kind of a stress. The second division of the autonomic nervous system is parasympathetic nervous system. This is generally referred to as the rest and digest system. Rest and digest system. So this is the nervous system that helps your body to do the kind of like the housekeeping functions, digestion, urination, defecation. All of these are under the parasympathetic nervous system. So it kind of brings your body to a restful state. Your breathing will slow down, your heart rate will come down, okay? So that's what this system does. So when you're resting, this is responsible for maintaining the activity of your organs, okay? So homeostasis at rest, this one will be homeostasis under stressful conditions. Now stressful means don't think it has to always be something that is really bad. No, even just waking up in the morning is sympathetic nervous system. Or starting your daily activities, going for an exercise, you need this, okay? You need this system. Or staying alert in class, sympathetic nervous system, okay? So that's the division of the peripheral nervous system. So this is a picture from your textbook which shows you the peripheral nervous system. On this side you have the sensory, on this side you have the motor division. So what I just told you in a picture form. Now, you already know about the peripheral nerves. We have talked about this in the lab. So the peripheral nervous system is mainly sensory nerves and motor nerves, right? So you do have some nerves are purely sensory. Okay, that means they only carry information to the brain and spinal cord. Some nerves are purely motor. That means they bring information from the central nervous system to your body parts. But majority of the nerves are mixed nerves. So a peripheral nerve will have both nerve fibers that are sensory and nerve fibers that are motor. So peripheral nerve is, majority of the time, it is a mixed nerve. Okay, so when you look at the peripheral nervous system, you know that it is made up of 12 pairs of cranial nerves and 31 pairs of spinal nerves which arise from the spinal cord. 31 pairs of spinal nerves, and you know there are 8 cervical nerves, 12 thoracic nerves, 5 lumbar nerves, 5 sacral nerves, and 1 coccygeal nerve. Okay, so 31 pairs of spinal nerves. And then you have 12 pairs of cranial nerves, which are numbered 1, 2, 3, 4, right up to 12. Now, all spinal nerves are mixed nerves. These are mixed nerves. That means they have both the sensory component and the motor component. They are all mixed. So a peripheral nerve will have both sensory fibers which are going towards the brain and spinal cord, and fibers that are bringing the information from the brain and the spinal cord. So all spinal nerves are mixed nerves. When it comes to the cranial nerves, some of them are purely sensory, some are purely motor, and some are mixed. So that's what here. Here it is, you have 3 different things. Now, we did talk about these nerves. We talked about how the nerves come out of the spinal cord. We talked about those. So I'm not going to waste too much time on that. I will probably post an audio file so that you can review the information. Okay? So we won't go into the details, but I will post an audio file on this again. Okay? So that you can sort of review the information. So all of this we looked at this in the lab. Peripheral nerve, what are the coverings? Okay, we looked at all this. So I'm not going to go over this. And even about the cranial nerves, I will post an audio file because we did look at this. But for each of them, I will try to, explain it to you so that you will have an additional resource for this. Okay. So cranial nerves, as I told you, you have 12 pairs of cranial nerves. Okay, so let me tell you which ones are sensory. So among these 12 pairs of cranial nerves, cranial nerve number 1, olfactory, which is responsible for smell. And I'm going to post an audio file, but this slide is important. Like, it's a summary of these cranial nerves. So it's good to know this one. Okay, it's good to know this slide. This is not from your book, by the way. It's from a different book, okay? So it's good to know this because it quickly gives you an idea about what it does. So first cranial nerve, olfactory nerve is the first cranial nerve. Optic nerve, which is the second cranial nerve number 2. And then cranial nerve number 8, which is vestibulocochlear nerve. Vestibulocochlear nerve, which is the 8th cranial nerve. 8th. These are purely sensory. Okay, they have no motor divisions. They are only sensory. Sensory. Okay. Now, purely motor would be, or mostly motor, would be cranial nerve number 3, oculomotor. Oculomotor nerve, which is cranial nerve number 3. Okay. Cranial nerve number 4, which is trochlear nerve. Cranial nerve number 4. And cranial nerve number 6 as well. Okay, trochlear abducens. Abducens nerve, which is cranial nerve number 6. Okay, and then comes the last two, 11 and 12. 11 is accessory nerve. Accessory nerve is cranial nerve number 11 and hypoglossal, the last one. Okay, hypoglossal is cranial nerve number 12. These are purely motor. So 3 purely sensory, 5 of them are purely kind of mostly motor. Okay, so accessory is like it's going to supply your sternocleidomastoid and trapezius, shoulder motion. Hypoglossal. Glossal means tongue. Okay, always remember, sometimes if you know the meaning, it is easy. So glossal refers to tongue. So this will supply the muscles of the tongue. Okay, hypoglossal. So these are purely motor. And finally comes the mixed nerves. Mixed. That is nerves which have both sensory and motor in the cranial nerves. So you have 3 here, you have 5 here, so that's 8. So 4 of them. So mixed nerves, trigeminal. Trigeminal nerve, which is cranial nerve number 5. Okay. Facial. which is cranial nerve number 7. Cranial nerve number 7, facial nerve. Then glossopharyngeal. Again, glossal, tongue, okay? Glossopharyngeal. Pharynx means the back of your throat. Pharynx, okay? This is back of your throat. Glossal means tongue. So glossopharyngeal is cranial nerve number 9. This is also a mixed nerve. And then the last one is the vagus nerve. Vagus nerve, which is cranial nerve number 10. Okay, cranial nerve number 10. So these are the mixed nerves. Now, one thing that I would like you to remember, because when we go to autonomic nervous system, vagus nerve. Okay, this is something I don't want you to forget. Okay, vagus nerve is the major parasympathetic nerve. This is the major parasympathetic nerve in the body. That supplies almost all internal organs. The word vagus means wandering nerve. So it goes everywhere. Okay, it supplies almost all internal organs, heart, lungs, intestines, kidneys, reproductive organs, you name it. Vagus is one of the major parasympathetic nerves. Okay? And I don't want you to forget this. And it is cranial nerve number 10. Okay? So I will post some details on each of this in the audio lecture. We'll do the same for the spinal nerves as well. You have looked at spinal nerves, so I will summarize the spinal nerves as well for you. Okay, I will post a audio file on that. So we have talked about spinal nerves. Okay, we have talked about all of this. Okay, you know what is the posterior root, what is the anterior root, dorsal root ganglion. We've talked about these things, okay, but I will post it. Now we've talked about these in the lab. You've looked at cervical plexus, brachial plexus, lumbar plexus, sacral plexus, sciatic nerve. So I won't spend time on this. I will post the thing for you. And then, so for all of this, I will post an audio file, okay. Now we go to the peripheral nervous system. We'll go to the sensory division, okay. Sensations. Let's start with sensations. So this is where it transmits the information to the CNS. Now, what is sensation? What exactly do you mean by sensation? It is a conscious perception. You're able to sense what has happened on your skin or in your deeper structures. So the conscious awareness that you have, that is what is called sensation. Okay. Now, whenever we talk about sensation, there are 4 important components to any sensation. So if you're able to say that I'm able to hear this beautiful music, that is a sensation. Okay, and for that you need 4 components. All of these 4 components must be working properly for you to appreciate that sensation. Even if one component is defective, you will not be able to appreciate the sensation. So the first thing, the trigger, okay, and some of these words you're familiar with because we've used these terms. So the trigger is called a stimulus. Okay, so you need to have a stimulus. It could be touch, it could be sound, it could be light. Okay, so stimulus is the trigger. Okay, so examples would be touch, pressure, pain, vibration, okay, or it could be light, sound, smell, odor, taste. All of this is a trigger. Okay. Now, in order to appreciate this trigger, the first structure that you need is a receptor. You need a receptor. What is a receptor? Receptor is a specialized structure that is able to detect the stimulus. Okay? So, it's a specialized structure that can detect a stimulus. Okay. Now, this specialized structure, then it will convert this stimulus, no matter what the stimulus is, this receptor will convert the stimulus into an action potential. Okay. So, that can detect a stimulus and convert it into an action potential, because remember, nerves only carry electrical signals. Now, this process where the receptor converts that stimulus into an action potential is known as transduction. Okay, it's called transduction. So, you should know what transduction is. Okay, you should know the definition. Transduction is the conversion of a stimulus to an action potential, to an electrical signal. So, everything that is entering your body, whether it is touch or pain or sound or light, all of these are different triggers, but the receptor, the structure that is detecting the stimulus, converts it into an action potential. So that's the first step, transduction. Okay? Then you need a sensory nerve to carry this. You need a sensory nerve to carry the information to the CNS. Okay, and that's the second thing. So, of course, stimulus is the first. You need to have a trigger, then you need a receptor, a sensory nerve to carry the information to the CNS. So, CNS, please remember, it is either the brain or the spinal cord, because there are some things that need not go all the way up to the brain. Your spinal cord is able to analyze it and produce a response for it. So you don't even need the signal to go all the way up to the brain. Sometimes the spinal cord can also do the job. So that's why I say CNS, it has to go to the CNS. After this, very important, you need a special area to interpret the information. So you need neurons that are capable of analyzing that stimulus and figuring it out what it is. Is it touch? Is it pain? Is it light? Is it sound? So you need a specialized area. You need a specialized area to analyze and interpret that sensation. Okay? So these are the components, main components of any sensation. Okay? Any sensation, these are the components. So now we're going to look at what are the characteristics of a sensation. Okay. Now these are things, like I've always told you, many of these things we take for granted because we are normal. Majority of us, most of the things, we are normal. So we don't even think of these things. But only when you lose something, then you realize the importance of that particular structure. Okay. Now, what are the characteristics? Whenever you look at a sensation, okay. Now, you know that, let's say, I touch my left palm, back of my palm, with the pen. Okay. So obviously, this is the stimulus. Pressure. Let's say this is pressure. Okay. I apply pressure. So there is a receptor that is detecting pressure. Okay. You have learnt about pressure receptors in the skin, Pacinian corpuscles. So they detect pressure. So that's the receptor. There is a sensory nerve which is going to carry that information to my spinal cord. And from the spinal cord, the information is going to go up. And it will reach, you know where it is going to reach. This is touch pressure. It's going to reach the parietal lobe, the post-central gyrus, which is the primary somatosensory cortex. That is where it is going to reach. The neurons in my parietal lobe are the ones that are interpreting this as pressure. They are not interpreting it as touch, they are not interpreting it as pain, they are not interpreting it as light, but they are interpreting this sensation as pressure. Okay? But the neurons that are actually figuring out that this is pressure are here. But am I feeling the pressure here? No. The pressure is still felt in the region of the skin. Okay? So that is what is called projection. So although the interpretation happens at the level of the CNS, the sensation is always felt at the location of the receptor. Okay? You always feel it at the location of the receptor. Okay? Where the source, where it started. This is called sensory projection. So the brain projects that sensation onto the region which has been stimulated. So you don't feel it here. So even when they are doing surgery on the brain, the patient is conscious. When they touch a part of the parietal lobe, the patient will say, I feel touch sensation on my left little finger. They are not going to say, because there are no receptors in the brain. Okay, no pain receptors, no receptors in the brain. So when they touch the parietal lobe, if the neuron there is interpreting the signal coming from the left middle finger, the patient is going to say, I feel touch sensation on my left middle finger, because the sensation is always projected to the source, that is to the receptor, wherever the receptor is located. This is called sensory projection. Okay. Now, second characteristic, another characteristic of sensation is what is called sensory adaptation. Okay. That is the ability, what is adaptation? The ability to ignore unnecessary stimuli. Okay. Your sensory system has this ability to ignore unnecessary stimuli. So let's look at what this means. Now, in the morning when I get up, get ready, I wear my clothes. When I wear it, I feel the sensation of the material. Okay, I know that, okay, I need to wear warm clothes. So I feel it. But after that, as I step out and as I'm doing my daily activity, I am not consciously receiving the sensation of my shirt touching my skin all the time. Okay, I'm not, although because I'm wearing this, obviously the receptors are being stimulated. The touch receptors are being stimulated. But am I constantly aware that, yes, my shirt is on and it's not off? Am I constantly aware of that? No, because this is unnecessary stimuli. As soon as I wear it, I know.
After that, my brain doesn't need to get this information. So the receptors that are there on my skin have adapted. They will not send information because this is unnecessary information. Same thing if you wear glasses. The first thing in the morning, you get ready and then you look for your glasses, you wear it. As soon as you wear it, you know it is there on your nose. But after that, you lose that sensation, okay? Because the receptors have adapted. They do not need to send this information consciously all the time to your brain to know. Sometimes there have been times when people wear their glasses or their glasses are on their forehead and they keep looking for their glasses. That has also happened. The reason is because the receptors, they get adapted. What is adaptation? They send less and less signals because this is unnecessary stimulation. So when they are constantly stimulated, they send less and less information, okay? So there are receptors that adapt very quickly. Touch receptors, pressure receptors, smell receptors, very good example of smell. If you like perfumes, you wear perfume in the morning, the moment you wear it, you get a whiff of that, you like the smell. Within about 5 to 10 minutes, your smell receptors have adapted. Whereas when you walk into a room, your friends are going to say, oh, that's a nice smell, that's a nice perfume, what is it? You yourself are not able to smell it because your smell receptors have adapted, okay? So there are receptors that adapt to very quickly touch, pressure, smell, even temperature. So when you hold on to a cup of coffee, the first time you lift it, maybe it's hot. And then after that, you're able to hold it comfortably. So that is fast adapting receptors. Okay, that means they send less and less signals when there is constant stimulation because this is unnecessary information. Now, receptors, there are some receptors that will not adapt at all, okay, because it's not beneficial. Pain receptors will not adapt, okay? Imagine if pain receptors adapted. Let's say you have some stomach pain and then your receptors get adapted. After some time, you don't feel the pain. Do you think doctors and nurses will have a job? No, because nobody will come. If they don't feel the pain, nobody is going to come to the hospital. So pain receptors don't adapt, and the receptors that are found in your muscles and joints do not adapt because you need to constantly know the position of your body, okay? So they don't adapt. These are slow adapting, or there are some which are in between, but these are receptors that do not adapt. So it's important to understand this because this is a very important feature of the sensory system because your brain is free to get useful information and all unnecessary information is blocked off, okay? So receptors that adapt very quickly and receptors that do not adapt. So fast adapting and no adapting receptors, okay? So these are the characteristics of the sensory system. So sensations. You can classify sensations into two broad categories. You can classify this into two broad categories. One is general sensations. What are general sensations? These are sensations that arise from the skin, muscles, and joints, okay, deeper structures. Any sensation that is coming from your skin, muscles, and joints is called general sensations. And then you have the second category, which is called special sensations. Special sensations which arise from arise or come from special sense organs. Special sense organs. Okay? So that is special sensation. Now let's look at what are the general sensations. So there are 5 general sensations. 5. Touch, pressure, vibration, temperature. So under temperature you have both cold and hot. Okay? And finally, proprioception. Proprioception. Proprioception means muscle and joint position. So position of your body, body position. That is what proprioception means. Okay? So 5. Touch, pressure, vibration, temperature, proprioception. Okay? Now these are things you have to remember, don't forget. Okay, here it is. General sensations. Okay? Special sensations arise from your special organs. So number 1, again there are 5 here. Okay, 5 special sensations. Vision, sight. The receptor that detects light is in the eyes. Okay, so the special organ is the eyes. Second, audition. Audition means hearing. Hearing. So the special organ where the receptors for sound, this is for sound, inner ear. Inner ear. So remember, any sensation, the first thing is a receptor. You need to have a receptor. So the receptor is in the inner ear. Number 3, olfaction. Olfaction means smell. Olfaction means smell. So audition is hearing. Olfaction is smell. Okay, so the receptors for smell, you know where they are. This is in the roof of the nose. That is high up. That's where it is. Roof of the nose. Okay. Number 4, gustation. Gustation means taste. Taste. Okay. Where do you have the receptors for this? The tongue. Okay, the tongue. And lastly, number 5. Anybody can tell me what is a special sense? Number 5. Balance. Equilibrium or balance. Equilibrium or balance. This is actually a special sensation. Okay? So the balance, maintaining balance when you are jogging, when you are turning, when you are running in a circle, or when when you're getting up from bed, walking, the balance. This is actually a special sense. And the receptors for this are also found in the inner ear. So the inner ear has receptors for 2 special sensations. One is hearing and second, balance. So 5 general sensations, 5 special sensations. Okay? Now for all of these you have receptors. You have special receptors which can detect the stimulus. Okay? And also classified into 5 types of receptors. Okay? So everything is 5 five types of receptors. A receptor that is capable of analyzing or detecting chemicals. Okay? Chemicals like smell or taste, chemical substances. So these are called chemoreceptors. Now again, these terms you should remember, because in Bio 142 you are going to be talking about chemoreceptors when we talk about respiratory system, how your body detects oxygen and carbon dioxide levels in blood. Chemoreceptors are receptors that detect chemical stimuli. Okay? Then comes, now some of the easy ones, thermoreceptors. Thermo means temperature. So thermoreceptors detect temperature, whether it's cold or hot. Okay? Thermoreceptors. That's the name for the receptor that detects temperature. Photoreceptors. Photo means light, photon, light. So photoreceptors detect light. So these are the receptors that are responsible for vision. Okay? So chemoreceptors, taste, smell, thermoreceptors, temperature, both hot and cold. Then photoreceptors, light. Okay. Then comes pain receptors. Okay, so for pain, you have a specific receptor. They are also called nociceptors. So you should know this name. The receptors that detect pain are called nociceptors. Okay. So what is it that they detect? They detect any kind of tissue damage. Okay, whenever your tissue is damaged, pain receptors are stimulated. Okay. Last, mechanoreceptors. Mechanoreceptors detect any change, mechanical change. Okay. For example, pressure, sound, that is what they detect. Mechanical changes. Okay. Photoreceptors, light. Chemoreceptors, chemical stimuli. This is mechanical stimuli, mechanoreceptors. So examples of mechanoreceptors: touch, pressure, vibration. That is what these mechanoreceptors detect: touch, pressure, vibration. Okay. Then you have sound. Okay, sound energy. Even the receptors that detect balance come under this. Okay. So we have covered all the sensations. If you can see these receptors, we have covered all the sensations, almost all, except for this one, proprioception. Proprioception is joint and muscle position. So you do have a category of receptors which are called proprioceptors. So some books will put them under mechanoreceptors. They will put them under this, mechanoreceptors. But some books will separate it out and it will call them proprioceptors. These are receptors that detect muscle and joint position. Okay, they detect muscle and joint position. Let's take a look at the general sensations very quickly. Each of these sensations, if you look into it, there's specific receptors, the structure of the receptor is different, and lots of details, but we're just going to summarize it. So if you look at, whenever I say receptor, please remember it is a structure that detects a stimulus. Okay? Now a receptor could be just the ending of a sensory nerve. It could be just an ending. So if this is a axon that is coming, it could be just something like that, the endings of the sensory nerve. Okay. Sometime the receptor could be a specialized structure at the end of the sensory nerve. It could be a specialized structure at the end of a sensory nerve, something like this. So if this is the sensory nerve which is coming to the skin, okay, so this is the end of the sensory nerve, and then there could be a specialized structure like that. Okay, so this is a specialized structure where you find the end of the sensory nerve. So it could be a specialized structure at the end of a sensory nerve, or sometimes the receptor could be just a neuron. It could be a neuron. Okay, it could be a neuron which is functioning as a receptor to detect the stimulus. Okay. So this is just to show you the different types of structures that are there in the skin. Okay? So you have looked at the skin, we have talked about the types of receptors in the skin. So you know. Okay? So some of them are just nerve endings. As you can see, some of them are just nerve endings, like this, free nerve endings. Some have specialized structures like this. Okay, they have specialized structure. So look at the Meissner's corpuscle. Okay. So we are talking about general sensations here first. This one, okay, which is found at the junction of the epidermis and the dermis, Meissner's, and then Merkel's discs, okay, Merkel's discs, which are also found in the junction of the epidermis and the dermis. Meissner's corpuscles and Merkel's discs, these are responsible for touch sensation. So they are found in the skin. Okay, these are responsible for touch. Now you already have learnt about Pacinian corpuscle, which is found deeper in the dermis. Okay, in the reticular layer of the dermis, you find this Pacinian corpuscle. Pacinian corpuscle is for pressure and vibration. So it is responsible for the sensation of pressure and vibration. So when you are standing on a vibrating platform, it is the Pacinian corpuscles which are there in the skin of the sole of your foot that are responsible for you to sense that pressure and vibration. Now, free nerve endings these are for pain. Mostly free nerve endings are receptors for pain. Okay. And then lastly, Ruffini's corpuscles that you see, these are for temperature. Just a few examples, okay? These are just a few examples of this. Sometimes free nerve endings can detect many sensations, but to give you a breakdown of this, okay? For temperature. So I have free nerve endings, this one for pain, specialized structure at the end of a sensory nerve. Those are these, Meissner's, Merkel's, Pacinian, Ruffini's. These are all specialized structures. And then I told you lastly, some neurons can serve as receptors. Neurons can serve as receptors, okay? So example for that. Okay, so this is the structure of a bipolar neuron. Okay, one cell body with an axon one side and dendrite on the other side. Bipolar neurons serve as receptors for smell. So these are the ones that are found in your nose. High up in your nose, you have these receptors, smell receptors or olfactory receptors, which are actually bipolar neurons. Okay, bipolar neuron. And you also find these bipolar kind of neurons in the eyes as well. In the eyes as well. Okay, so you don't find bipolar neurons anywhere else. Nose and eyes. So they serve as receptors. Okay. So if you think about these receptors which are responsible for smell, they are right here. So when you go to the mall to buy a perfume, they give you a sample, and so they spray it on a paper and you smell it. When you smell it, you take a deep inhalation. Okay, you take sniff. Why do you sniff? Because you want the air to go all the way up here, which is where the receptors are, okay? So that you can appreciate what the smell is. Now, these bipolar neurons, these are the only neurons that are exposed to, so these smell, okay, olfactory neurons. Olfactory bipolar neurons that serve as receptors for smell. These are the only neurons that are exposed to the external environment. Every other neuron is inside your body, covered by skin or covered by other structures. This is the only neuron which is actually exposed. Okay? Olfactory neurons exposed to the external environment. And so they are more likely to be damaged because they are exposed to the external environment. They can be damaged. So any sharp blow to your nose can damage the smell neurons. Even after COVID, some people had damage to their olfactory receptors and loss of smell. Okay? Another feature of these olfactory neurons is that these are the only neurons that can regenerate. There are stem cells. So you lose some olfactory neurons, new neurons will be made. So these are the only neurons, because remember I told you neurons do not divide by mitosis. A brain tumor is usually made up of neuroglial cells because neurons cannot divide. But exception, olfactory neurons are the only neurons that can divide after birth. That is, in adults also they can divide. Okay? So that's an exception for this. So please do know this. You will be seeing a model of the nose when you come to the lab on Wednesday. But it's important to know this because there are two significant characteristics. No other neuron is exposed to the outside of your body. This is the only neuron. And then this is the only neuron that can actually divide. Okay? Told you this. Okay? Now, thermoreceptors, we can sense both heat and cold. Okay? So we do have special receptors that respond to cold temperature. We have special receptors that respond to hot temperature. So it's not like one receptor does the same thing. It actually responds. The fun part is that you have more number of cold receptors than warm receptors on your skin. About 4 to 10 times more cold receptors, okay, which can sense the cold. Okay. So cold receptors they have a range of temperature at which they kind of work best. So they are able to sense temperatures between 50 and 68. That's the optimum. Doesn't mean that's all that they sense. They are most sensitive to a temperature that is between 50 and 68 degrees Fahrenheit. And warm receptors usually can go up to anywhere from 85 to 113 degree Fahrenheit. This is most sensitive. Okay. Temperatures below 50 degree Fahrenheit, exposure, that means if you are not properly covered or attired, temperatures below 50 or temperatures above 113 is going to cause tissue damage. Okay? And once the tissue gets damaged, it is not the thermoreceptors that will be stimulated, it will be the pain receptors that will be stimulated. Okay, so damage because of cold or heat, it is the pain receptor. So in a burns patient, you're going to have the pain because the temperature is so high, the skin and the tissues have been damaged. It is the pain receptors that are stimulated. So remember, temperature receptors work between certain temperatures, but very low temperature, very high temperature, tissue damage will occur. Okay? And once tissue damage occurs, it is the pain receptors that are going to get stimulated. Okay? And they are going to cause the pain. Right? Proprioception, which is the sense of body position. And then we're looking at the general sensations. So I've already talked to you about touch, talked to you about pressure, we have talked about temperature. Okay? Now we're going to talk about proprioception. Okay? So what is proprioception? I've already told you it detects the position of your joints and muscles. So what is the degree to which your muscle is contracting? Okay, what is the state of the skeletal muscle contraction? What is the position of the joint? Okay, to perform any activity, your brain needs to get constant information about the position of your body. Okay, whether it is as simple as walking or climbing up the stairs or playing a game or playing a sport or playing an instrument, your brain needs to get constant information about what is happening in your body so that it can make adjustments. Okay, so the cerebellum and the cerebral cortex can make adjustments so that your voluntary movement is precise. Okay, which is what these proprioceptors do. So if you look at the examples of receptors that are involved, Pacinian corpuscle detects pressure. So for proprioception, you still need this receptor as well. it is going to tell the brain about the pressure, okay, which part of the body is experiencing pressure. So you need, Pacinian corpuscles are also found around the joints, okay, so pressure. So you need this. Next, you need a special receptor that is found within every skeletal muscle. Every skeletal muscle has a receptor which detects how much of the muscle has been stretched, or what is happening to the length of the muscle. Is it contracting too much, or is it not contracting sufficiently? So this receptor is called muscle spindle receptor. Okay, let me show you a picture of that. So this is a muscle spindle receptor. So within the muscle bundle, so if you take the deltoid or the quadriceps, within the quadriceps muscle, inside, you're going to have specialized muscle fibers which are called muscle spindle receptors or stretch receptors. So you will see the sensory nerve winding around this. Okay, so these are, again, they are skeletal muscle fibers, but they have a special function. Okay, they are going to detect stretch. Okay, so muscle spindle receptors. So this is found in all skeletal muscles. All skeletal muscles, you're going to find this muscle spindle receptors, or also known as stretch receptors. Okay. Now, what are these receptors for? Whenever the muscle is stretched, okay, the information about the stretch will be sent to the CNS, and the response is muscle contraction. So what do these muscle spindle receptors do? The function is they detect stretch of the skeletal muscles, they detect the stretch and send the information through the sensory nerve to the CNS. And how does the CNS respond? The response of stimulating these stretch receptors is contraction of the muscle, skeletal muscle. So the response is contraction of the skeletal muscle. So when we do reflexes, we will look at this again. So remember muscle spindle receptors. What is the purpose? Why do we need these muscle spindle receptors? Obviously, the brain needs to know what is happening to your muscles in order to adjust your posture and position. But these are the receptors that are very important for maintaining posture, okay, for maintaining posture. So even if I'm standing straight, doesn't mean my muscles are not contracting. My muscles of the legs are contracting, my muscles of the back are contracting, my neck muscles are contracting. So how does the brain know how much of contraction is necessary to maintain an upright posture? This is because my muscle spindle, these spindle receptors which are there in my quadriceps, which are there in my gastrocnemius, soleus, my erector spinae muscles, and my cervical neck muscles are constantly sending information to the brain and the spinal cord about the position. And the brain is making adjustments in the contraction of these muscles. So these muscles are contracting so that I'm able to maintain an upright posture. Okay? Very important, muscle spindle receptors. Now, there is another receptor which is also necessary for body position. This is called the Golgi tendon organ or Golgi tendon receptor. Okay. Now, where is this Golgi tendon receptor found? The Golgi tendon receptor, as the name indicates, it is found in the tendon. Okay, these are free nerve endings. This is the sensory nerve fiber. These are found in the tendon of the muscles, the tendon that connects the muscle to the bones. The Golgi tendon organ is found in the tendons. What is the purpose of the Golgi tendon organ? The purpose of the Golgi tendon organ is to detect how much the muscle has contracted. So it has to send information to the brain about how much the muscle has contracted. Okay? Because you don't want excessive contraction of the muscle, which is going to sort of, it's going to rip the tendon off the bone. You don't want that. Okay? You want to maintain the force or maintain the tension so that the tendon doesn't get ripped off from the bone. So this is a protective reflex. Okay, so the Golgi tendon organ, that's another receptor for maintaining body position. So Golgi tendon organ or receptor. Where do you find this? Found in the tendons of skeletal muscles. What is the function of this Golgi tendon organ? To detect the contraction of the muscle, the severity, the degree of contraction of the muscle. Once it detects the contraction of the muscle, if the contraction is too strong and if there is a danger that the tendon is going to rip apart from the bone, it is going to send information to the central nervous system, and the response will be relaxation of the muscle. So see the difference between the two. Muscle spindle is going to detect stretch, and the response is it will cause contraction of the muscle. Golgi tendon organ is the opposite. It is going to detect the contraction of the muscle, and the response is to relax the muscle. Okay? Now, the example of this is very clearly seen if you're interested in watching the Olympics games, weightlifting and all that. When you look at these weightlifters, they go in for different categories. So they hold on to the bars, and then they sort of wait for some time because they're trying to build the tension in their muscles to lift that weight off the ground. Okay? So some of them are successful in lifting the weight, okay, and then of course they have to lift it above their heads. So some of them are successful in that. Whereas some, even after some time, even after the muscles contraction has occurred, they lift it, and then all of a sudden, whether they want to do it or not, subconsciously the weight drops. They are not able to hold on to it. Why? Because when they lift the weight, the contraction of the muscle is so strong that there is a danger that the tendon will rip off. So this Golgi tendon organ gets stimulated. It sends information to the central nervous system saying that there is a danger, the tendon might rip off. So without the individual wanting it, the weight will drop. They are not able to lift it. Okay? So that is a very good example of how the Golgi tendon organ works. Okay? Is pain important? Obviously. Why? Because pain sensation tells you that there is some tissue damage happening in the body, okay? Which is why you actually go to the clinic, you go to see your physician when you have pain. If there's no pain, you're not going to go, okay? So pain is always an indicator that there is some pathology, something going on inside the body which needs to be checked. So, tissue damage, I've already told you this. Now, it is a warning sign, okay, that something is going wrong. The receptors are called nociceptors. They don't have a special structure. They are just free nerve endings, okay. Now, what is it that stimulates these free nerve endings? What is pain? So, when tissue damage occurs, there are a lot of chemicals that are released, okay. Now, these chemicals they are coming from the tissues. Chemicals like bradykinin, serotonin, histamine, and when a cell breaks, potassium, because inside has a lot of potassium, so potassium is released. All these chemicals will stimulate the free nerve endings, and that is what causes pain. So pain is a sensation that is brought about by the release of chemical substances from damaged tissue, okay. And these are some of the examples of chemicals that stimulate the pain fibers, okay. So whenever there is tissue damage, this can happen. It can be any kind of tissue damage. The damage could be because of excessive pressure or a crush or an injury because of a road traffic accident. Or it could also be because of blockage to the blood flow to an organ, okay, which you are probably not aware of, but blood flow to an organ can get obstructed, the organ doesn't receive oxygen, and that can also cause tissue damage, okay. Now, this is something I want to ask you, most of you probably know this. When someone is suffering from a heart attack, okay, let's say blood flow to the heart, the blood vessels are blocked, so blood flow is inadequate to the heart. So during a heart attack, when a person is experiencing a heart attack, sometimes the pain is actually felt over the heart, okay, over the left side of the chest. It's like a crushing pain, or it's almost like, the description is like as though somebody is sitting on your heart, okay, like a big stone has been placed on the heart. It's like a crushing pain. And then they feel breathless, they may have sweating. But majority of the time, you will see that people who are experiencing a heart attack do not have pain classically on the chest, okay. The pain is usually felt elsewhere. What happens? What are the classic features of a heart attack? Where do they experience the pain? You must have read about it, you must have heard about it. This is quite common. Yes, arm, left side, okay, because the heart is on the left side. Many individuals will not experience any pain over the heart. The pain is felt over the left arm, okay, left arm and radiating down like that. Or sometimes the pain is felt over the left side of the neck, or the left side of the jaw, or sometimes the back. And in many cases, you will also find pain in the epigastrium, this region, okay? The abdominal components, upper abdominal region. The pain is not felt over the heart, okay? So after the age of 40, when anybody goes to the ER with pain along the jaw, severe pain along the jaw or along the left arm or in the epigastrium, the first thing they will do is do an ECG, because it could be that the person is experiencing a heart attack, okay? Now, pain coming from internal organs, okay? Try and understand this. Pain arising from internal organs is generally felt in a region of the body away from the damaged organ. Okay, pain that is arising from an internal organ is normally felt in any region of the body that is further away from the organ and not over the organ. Not over the organ. This kind of pain, this is very classic for pain coming from internal organ, when an internal organ is damaged. If it is the skin or the muscle, then you will feel it there, okay? But if it is coming from an internal organ like the heart, the intestines or kidney, it is generally felt away from the organ. This is called referred pain. And it's very important as healthcare workers to know about referred pain. Because you work in the ER, you're an ER nurse, you see a 40-year-old coming and saying that I'm having pain along my left arm and my jaw, I'm not feeling comfortable. And then you say, oh, you just check him, BP looks okay, everything looks okay. You say, okay, take an Advil, go home, rest, everything is fine. Next morning, the person might have a severe heart attack, maybe admitted to the ICU, or God forbid, they may not be alive. So you have to know about referred pain, because this is very common when pain comes from internal organs. Kidney pain, always felt in the low back or in the genital regions. Okay. Liver damage. The pain is usually felt liver and gallbladder. Liver and gallbladder. You don't have to, liver is on the right side, gallbladder is on the right side. You need not have any pain there. The patient will come to you with pain, tip of the right shoulder. So they'll have pain here. Appendix, which is on your right lower quadrant of the abdomen, appendix. If the appendix is inflamed, if the pain is coming from the inflamed appendix, the pain is usually felt around the umbilicus. Around the navel. Okay? So it's felt around the navel, not. So there are many instances where the pain is referred to another region of the skin. Okay, it's not classically over the organ. There is a theory behind this, there is a reason behind this. We will look at it later, okay? Why? And then we look at some types of pain in the next class. So we should finish. On Wednesday, we will finish reflexes as well, and we will start autonomic nervous system. In the lab, we will do eye and ear, okay? Eye, ear, nose and taste is nothing much. So we will do that in the lab, okay? So